The dietitian's role is basically to empower and educate and motivate the patient, because it's a lifetime process, and obviously it incorporates food and nutrition and psych and all of these areas, but we really have to coach the patient and give them skills and tools for their toolbox, is what we call it, in order to be successful long term. Otherwise, they're floundering after surgery, and we don't want that to happen. We want them to have a good experience and be successful with their weight loss. Some of their biggest fears, I would say short-term fears and long-term fears. So short-term fears initially is, oh my gosh, am I going to have food not go down right? Or am I going to have intolerances with food? Or am I going to have constipation or dehydration, all these things that they hear about. And we have a very extensive preoperative class that educates them on all the reasons why those things are happening and how to avoid them. So we give out constipation bowel regimens to prevent constipation, and oral rehydration instructions to prevent getting to that point where they're having the dehydration, and how to prepare their food. And we provide recipes and how much to measure to eat and how slow to eat, in order for those situations not to occur, so that they're prepared going into the operating room and coming out of the operating room. The other set of fears are more long-term fears, and they're always kind of the same fear. Am I going to regain my weight back? Am I going to hit a plateau? Am I going to have nutritional deficiencies and medical complications from that? So we have a really extensive class that deals with, let's just pretend that you had the procedure and you're out of surgery a year to 20 years later, and this is all the how, what, when, where, why behind everything you're doing with bariatric nutrition to avoid all of those things. But we emphasize the why, because adults need to know why they're doing this a certain way, or they don't understand it. And I always tell my patients, bariatric nutrition makes absolutely no common sense. And it's not a matter of counting calories and points and buying frozen food and taking a pill. It's really a skill set that you have to learn in order to be able to do what you need to do to be successful with that. And so we spend a lot of time explaining all the reasons behind this weight regain and malnutrition and plateauing, and how to avoid all of those things. And there is a way to do that if they're being given the appropriate information on the front end of the surgery. The food plan is basically a food plan. We hate the word diet. The food plan is a food plan. I always tell my patients, diet is the 4-letter word we throw in the garbage can and we never look back. So it's really eating on a 6 to 8 inch plate, much like we did in 1950. And we're following normal FDA serving sizes. This is when we're a year to 20 years out, based on a recipe label and a food label. And you're going by food groups. So how many fruits, how many servings of vegetables, how many servings of protein, how many servings of grains, whole grains, and carbohydrate foods can we have, and good fats in a day that will fit in our pouch a year to 20 years later when it's all said and done. And then we teach them extensively on the food labels and how to shop and cook and prepare foods, those skills that they need to be really successful, so that no matter what label they pick up, what new product comes out on the market from the food industry, they're going to be able to pick that up and go, oh, this is going to work, or this is a good choice, or this is not such a good choice. So that way the weight regain really doesn't happen. There's a certain way we have to eat with bariatric procedure to fool the brain and the stomach to pull down the fat stores. So there's really reasons behind what we're teaching them. And I think the biggest thing is the why. It's low fat, low sugar, high fiber, whole grain, and we really emphasize the differences between the fats and the carbs and the sugars, and how many grams a day can we have in a food label and in a day, so that they are prepared for all of those decisions to be able to make those choices. And it's really eating healthy. So it's not something that the whole family can't do together. It's what all of us in America should be doing anyway. So it really helps people, family members that come in with the patient, who want to lose a few pounds, and everybody wins. And it kind of, I call it the trickle down effect. Everybody gets a benefit from it. So it's not really a fad diet in that sense. It's not anything out of the ordinary that everyone would not be doing together. It's just they're eating a lot less than maybe someone else in the family that hasn't had surgery. So it does normalize, become a normal lifestyle, and we really emphasize lifestyle, permanent change that's ongoing, and that creates a need for long-term follow-up. And it's a journey, and it's a process, and we all hate change. But if we implement a little bit at a time and we make it realistic and doable in this person's life, then it's a permanent solution.